You're watching Virginia This Morning. This segment is sponsored by Bon Secours and Wegmans.
We've taken a little field trip today to Wegmans. We're here at Short Pump. Of course, there are several locations in the greater Richmond region. I'm with Dr. Michael White. He's a surgical oncologist with St. Mary's Hospital, part of the Bon Secours health system. We're talking today about screening ahead of one of the most preventable cancers out there right now, colon cancer. Dr. White, this is something that really everybody needs to be aware of.
That's right. Thank you for having me today. Colon cancer, as we are realizing, is just becoming more and more prevalent. We're seeing it in a lot of younger patients. But it's one of those cancers that we do a very good job of treating if we catch it early. It really emphasizes the importance of screening and early detection. For years we've done colonoscopy and realized that with colonoscopy we can detect colon cancers early. We can catch them a lot of times before they become a cancer as a polyp, which can essentially prevent people from getting colon cancers. And so we're here today to kind of discuss the importance of screening and early detection for both treatment and prevention of colon cancer.
Before we got started, we talked about that colonoscopy being the gold standard, as you called it. But it's good to evaluate risks ahead of time. What are some of the risk factors?
So colon cancer can hit both men and women. It is not really selective between the two. We do know that some things that increase your risk are a family history of colon cancer, obesity, living in a sedentary lifestyle, excessive alcohol intake, smoking. Those are all certainly things that can increase your risk. Additionally, diets that are high in red meats are also a risk factor for colon cancer. So those are some things that you can modify to help reduce your risk. But it's still a prevalent cancer in both men and women. We see about 140,000 new cases of it diagnosed each year in the United States. And it is the third most common cancer in both men and women, aside from skin cancers.
Is this affecting certain populations more than others? Is that a risk factor?
So we see it kind of diffusely throughout the population. There are a lot of data coming out now about colon cancer developing in earlier ages or age ranges, so in younger patients. We see lots of people now in their 30s and 40s. There's a lot of research going into why this may be the case. Certainly this is highlighted by the fact that the American Cancer Society just recently changed their screening recommendations and have actually changed the age for your first colonoscopy to go from age 50 down to age 45 now. So certainly trying to emphasize the importance of catching this early and starting at a younger age to catch this.
So in the meantime, the colonoscopy is the gold standard, but we have these kits available, the 30-second colon cancer screening kit. This is at every area Wegmans locations. You can pick this up. It's a partnership between Bon Secours and Wegmans. This offers a little peace of mind.
It does. This is a simple test that you can do at home. It doesn't require handling of any of your stool. It's a very simple test to do, and it can give you some information. Essentially what this is looking for is for traces of blood in your stool, which can be a sign of cancer. Often the blood is not visible, and so this test is a way to look for that. It's certainly not able to help you prevent a colon cancer like a colonoscopy or detect it in the form of a polyp necessarily, but this test can be done to help provide some extra peace of mind. It's a method of screening, and certainly any positive test from this would be recommended to be followed up with a colonoscopy.
Absolutely. You'd follow that normal recommended age 45 by the American Cancer Society for screenings, but this could give you the peace of mind to get the ball rolling to take that next step.
That's right. And like you said, it is available here for free at Wegmans, so you can pick that up, or it's available at all the Bon Secours locations as well.
And I feel compelled to say, I know you must deal with this all day long. People are very hesitant to come in and take this test, not the free screening, but to schedule their colonoscopy. But this is a matter of life and death. It really can be a game changer.
It really is. I think a lot of people shy away from colonoscopies because they're afraid of the procedure, but it's a very safe procedure, and it really can make a huge difference in preventing you from getting a disease that can be life-threatening. And so I wholeheartedly support the recommendations to go through and do that. Just talking with your physician is kind of the first step, and they can give you some reassurance and discuss the procedure with you. And certainly this take-home test that's very simple and easy to do without a prep can also kind of give you some peace of mind going into that discussion.
Doctor, thank you very much.
Yeah, thank you for your time.
We're going to share some information. Free colon cancer screening kits are available at area Wegman locations and at select Bon Secours locations. For all the information and a complete list of all of the locations, visit bonsecours.com/detection.